This is Dr. Benzinger on Health with SecondOpinion.org. If you've not joined us before, welcome to the program. Today we're going to be covering vitamin A, an extremely important vitamin in our regime of staying well. And my goal is to educate you well enough that you understand what vitamin A to get, where to get it at, what to use it for, its value and its purpose, and to make sure we don't abuse it. Covering just the forms in which you want to try to get vitamin A in. First of all, there's a form called retinol and retinil. Okay? Retinil is more stable and you need more of it to be able to get a high enough absorption of vitamin A. And remember, you can replay this session over and over until you get all this down. Retinol is, you need less dosing, but it's better absorbed and utilized in the body. So retinil, the YL, is more stable. It's utilized more often in many of the nutrients and skincare products that you see out in the market. But the problem with it is you have to take quite a bit more to be able to get enough into the body. The retinol, NOL, is less that you need, but absorbs even better. There's another form called retinil palmitate. Okay, and you'll see it here on your session here. You'll be able to see it right front view and actually make notes of this. It's found only in animals and in plant eaters, but it has a very, very big value that we'll cover in just a little bit. And retinil acetate is a dry form. So sometimes you don't see them in those little liquid capsules. They actually come in a dry form. And what we know is vitamin A also has a special form called retinol, okay, called beta-carotene. It's found in plants and animals, but more so in plants. And basically, it's two vitamin A's that are tied together, and that's called beta-carotene. Beta-carotene's got some really big values in it, and the reason why is because beta-carotene is water-soluble, and you can take lots of it without any side effects or potential side effects. And remember, the possibility of overdosing on vitamins that ends up harming your health is very minimal in this society unless you're working really hard and taking an inordinate amount of numbers, or if in fact you have some specific disease processes that really weaken your system's capacity to get rid of it. Vitamins and minerals are very hard to overdose on. So let's get over the scare of vitamins and mineral overdosing being something that compromises your health on a consistent basis. Because can it? Yes, but it's very difficult to do so. Now let's just cover just some of the basics, what it is to be a vitamin. A vitamin is an organic substance. Organic meaning that comes from the ground or the earth. That is vital for health. In other words, the majority of vitamins cannot be synthesized in the body, so thus you have to either dietarily supplement or you eat those vitamins. That's how you get it in. If you don't get them, remember they're necessities for the body and the body can't make it. Okay? Fat-soluble vitamins, which vitamin A is, except for the beta-carotene part, which is water-soluble, is required. Frankly, you have to have enough fat in your diet to be able to absorb vitamin A, which is a fat. Kind of interesting, isn't it? We've been told fats are bad, fats are bad, fats are bad. Well, the whole thing is you'll find later that certain medication interactions that we're utilizing to control cholesterol as well as triglycerides in our body is sacrificing our vitamin A levels and sacrificing individual cell-to-cell well-being that we have to cover, and that's why we have to look at it. If you look at it here, you can actually see what ascorbic acid itself, okay, natural vitamin C. And the reason why I put these things up for you to see, look at the color schemes. It's just really interesting is things that are refined, which is the ascorbic acid, the orange juice, commercial white flour. You look at those things, look at the color difference, look at the second row. Natural vitamin C comparison to a popular drink and homemade whole wheat. Look at the difference in the colors. If you notice, the things that are more natural, the things that are in a pure form, are brighter colored, a wider variety of colors, and it's not just blanche or plain. And the reason why is because those nutrients and vitamins that are in that is what brings that color alive. Okay? We need to talk about synthetic and natural forms of vitamins just so you get an idea. What we know is most forms of vitamins are processed out of their natural form. In other words, most of them are gotten out of peas or apples or things like this. It is very important to take this nutrient with other synergistic nutrients that make them work better. Synergistic means works together. Okay? The bottom line is when you're looking at nutrients, they don't just come as palmitic acid or just vitamin A by itself. Unfortunately, we've refined it down and tried to pin it down to a specific element. Well, the truth is, in nature, it doesn't happen that way. And number two, your body needs other elements to be with it to make it work. It's kind of like an assembly line that you want to make cars. Well, the truth is, let's say the assembly line needs 7 different people to work on the assembly line to complete a car. Okay? Let's look at it that way, okay? And if in fact those 7 people aren't there, a few people are missing, okay? The bottom line is, more than likely, what's going to happen is you're going to have to call in reserves to fill in those spots. So you have 7 people to help you make that car. Eventually, when there's not enough reserves there, in other words, not enough people to fill that 7-step process, guess what happens? It just doesn't happen. The process of vitamin A converting into a usable form in the body stops when you don't have these synergistic nutrients, and we're going to cover what those are. So here's the whole point. Without the synergistic nutrients included, your body uses its reserves and can create a deficiency in its reserves because you're not taking it as a whole food form. So you're going to find most nutrients that we're going to recommend to you are food form based, or they have the other synergist added into them whenever possible. Or if we can't get it to you in that form, we recommend certain foods be eaten with those nutrients at that time so that you don't burn out the synergistic nutrients, okay? In fact, here are the synergistic nutrients. You'll see them right here. B-complex vitamins need to be there with vitamin A, vitamin D, vitamin C, calcium, phosphorus, and zinc. Now, certain proteins, carbohydrates need to be there too. But here's the key components that you need to try to have in an element. That's why multiple vitamins, when taken together and given to you in a good, healthy form, a form that's easily assimilated to your body, which again we're going to cover, that's the whole point of this series, really helps if you have these together to get vitamin A into your system. Again, let's look at these 2 viewpoints of vitamins, okay? Vitamin factors or parts can be synthesized. We already know that. We can make it a pure isolated form. But the whole point is, when we have it as a whole food, in other words, I'm promoting the idea to get most of your nutrients through food sources whenever possible, because if you can do that, you're way ahead of the game, because you have all the elements at one time, you don't have to worry about any other deficiencies, and you'll get healthier faster. But the whole point of it is, we have such a poor diet, and the way we're producing our food, if you've not seen our Secrets to Vital Health seminar, please pick that up. It's right on the net. You can pick it up or call the office. We'll get a copy to you. Reason why is because once you understand what we're eating and what we're drinking in this society, you'll know why supplementation in most cases has to occur. Here you'll see just kind of a worded explanation about broccoli. And the reason why is, when I say you should try to eat the food, here's a good example. Look at all these elements. Well, what if you're deficient in one of these unique side elements while you're trying to take vitamin A and it's just not there? I mean, vitamin A is not going to supply all of this by itself, and no multiple vitamins going to do so. In fact, let's go on. Look at what's in an apple. You ever heard the apple a day keeps the doctor away? Well, it should. Look at all the stuff you get with a good, healthy apple that doesn't have many chemical pesticides or herbicides on it, and you've well cleaned it, and if possible is organic, and it's been well nourished. Guess what? You're really making a difference in all these elements getting put into your body. So an apple makes a big, big difference. So let's look at the conditions that this nutrient, vitamin A, may help in your body. It might help abnormal pap smears, acne, cataracts, chemotherapy support, Crohn's disease. And by the way, when we talk about cancer treatment and chemotherapy and radiation therapy, there's a massive amount uncovered by most oncologists and by the books at this point as to what you do. The point of it is, vitamin A is a necessity to be there every day for the rest of your cells to be healthy. Yes, we want to get rid of your cancer cells. Here's the problem. If we diminish the amount of vitamin A in your body over a long enough period of time, we will create any, if not many, of these other types of diseases. So, okay, we start killing off cancer and we cause a bunch of other things. There has to be something that happens in the cancer regime to clarify what nutrients are capable of helping you during this time, and how many you take and what dosage you take while you're going through active treatment for cancer. Crohn's disease, immune function in general, macular degeneration of the eyes, there's a big issue there, measles, heavy menstrual periods. And are all these fixed by just vitamin A? The answer is no. But in combination with other actions, possibly you might be able to help your health. And I've seen cases, in certain cases like night blindness, and you're looking at them right here, where my night vision was getting worse and worse and worse. Noticed it, increased my vitamin A dose over a month to 3 month period of time. And frankly, it's amazing the difference. You know this stuff, but sometimes when you get to apply it even to your own self, it's amazing what it does for you. Peptic ulcers. Photosensitivity light. You go out the light, you go out from inside to outside where the sunlight is, and all of a sudden your eyes are tearing and you're really struggling with that. B vitamins with vitamin A can make a difference in many of those cases. Premenstrual syndrome, recurring ear infections, and urinary tract infections, okay? When you look at the food sources you want to get it in, fish liver oils. You're not probably going to eat the fish liver oils, but you might supplement with those, and those will be very, very healthy for you. Like cod liver oil, been giving it for years. What happened to some of our parents and grandparents? You used to get a big tablespoon of that before they headed out of the house. Why did Mom do that? To prevent sickness in the winter more so than any other time, okay? And the problem is, some people actually like the taste. Now they got all kinds of options to be able to improve the taste, but the bottom line is, fish liver oils are very, very healthy as long as you're getting them from a good source. Creamed or whole milk, butter, dark green leafy vegetables, yellow and orange vegetables, sweet potatoes, egg yolks, and fruit. The risk group of vitamin A deficiencies, children, have a high issue with this. Why? Poor quality diets, low calorie diets. The more if you have not picked up that seminar on Secrets to Vital Health, this would explain it, but when you're in a low-calorie diet over a long period of time, usually vitamin A deficiencies or just diminished amount of vitamin A so that you don't have optimal health and optimal well-being does occur in these cases. Liver diseases promote it. I mean, the more you have problems with that, the liver is very key to vitamin A. Highly stressed individuals. Pregnancy and liver disease women should avoid vitamin A supplementation above 2,500 international units unless you have the doctor following you very closely in these situations. So pregnancy and liver diseased women specifically, okay? Toxicity, extremely rare, but here's some of the symptoms if you do end up just overdosing on it for a long period of time to a point where it has an issue. And again, I reiterate, it is very infrequent, very uncommon. It is I would like to say that it's not worth paying attention to, but it is. It can happen. It just hardly ever does. Vomiting, joint pain, abdominal pain, bone abnormalities, cracking of the skin, dry skin, headaches, irritability, and fatigue. Again, can it happen? Yes. Does it happen frequently? The answer is no. Your likelihood is shortage, not too much vitamin A in large majority of the cases. Absorption of vitamin A is blocked with antibiotics, laxatives for those ladies most of the time, but men too, that take laxatives to keep their bowels going on a consistent basis. And the elderly sometimes live on laxatives, induce vitamin A deficiency. Antibiotic use on a frequent basis, vitamin A deficiencies start to occur. And some cholesterol-lowering drugs, you have to know, they play with reducing fat absorption and utilization. Guess what vitamin A is? A fat, unless you're taking it in the beta-carotene form. So here's some of the medication interactions that you need to pay attention to. Statin drugs, pay attention to them. Will your doctor know about this? They know it intuitively, they know it in knowledge. Do they cover it with you? The answer is usually no in the large majority of cases. But I commend many of the doctors that are stepping up to the plate and starting to understand that medications in most cases induce certain nutrient deficiencies that these patients need to know about and start helping themselves take care of, because our food groups, unless you're eating a perfect diet, usually does not take care of those situations. Zocor, many of the cholesterol-lowering drugs related to that family. Mineral oils, if you're using that to keep your bowels clean. Antacid medications decrease your capacity to break down fats so they can be absorbed, because you need hydrochloric acid. With that which antacids are trying to control, ends up reducing your capacity to break down vitamin A and thus utilize it. People who have lots of colon problems have a tendency towards vitamin A being a consideration for a problem. Cortisone, hydrocortisone, or prednisone itself. People with asthma or multiple inflammatory arthritic conditions take lots of those things. And unfortunately, vitamin A deficiency goes right on up the list at that point. Neomycin, Rhinocort, Aluminum hydroxide, again, those things that you're putting in your armpits, if it's got aluminum in it, often will induce some of these problems or move you towards vitamin A deficiency. And considering it does so much good for you, you have to be considering that this is something you want to make sure is in your multiple vitamin, and if it's not, supplement appropriately, and if you have conditions, supplement appropriately with someone's assistance, okay? Recommendations of the RDA dosage: 1 to 3 years old is 2,000 IUs, 4 to 6, 2,500, 7 to 10 years old, 3,500 IUs, 11 and more, 11 years old on up, kind of goes with men and women, men at 5,000 IUs and women at 2,500 international units. I like beta carotene to be elevated much beyond this because it is water soluble, safer, and you don't have to worry about the side effects associated with beta carotene. Frankly, if you just eat too many carrots, you get a little yellow tint to your skin. Is it harmful to you? No, unless you have liver disease, period, okay? So here's Dr. Benzinger's advanced information that is a little bit more detailed for those folks, and again, we can't cover everything, but we're going to do our best to let you know what vitamin A is related to. If you're on medications related to this, get aggressive with your pharmacist and your doctor about, how do I know vitamin A is not an issue, and shouldn't I supplement a little bit with this, and kind of take care of it, because we know it's going to induce some vitamin A deficiencies or interfere with vitamin A usage in our body, and it's extremely important to our well-being. Vision and sight. Vitamin A is required to transform light reception in your eye to the brain so that you can picture it. In other words, that you can see it, so that the amount of light that's not only allowed in, but how it's transferred into your brain so you can see what you need to see. Because you know, as the lights get dimmer and as you get older, you start having problems. So the truth is, in some cases, you just have a suboptimal level of vitamin A, and that could be an issue. So if you're having problems with vision and sight, mostly at night, might be a consideration. Cataracts are another consideration that we've noted. Reduction in its frequency or slowing its process is cataracts with vitamin A. Okay, retinol again starts the chemical process and the signal in the brain that makes sure that when the light strikes that eye, that you can actually transfer it all the way back. So retinol is really, really important. And one of the first signs of deficiency is night impaired vision. So we've got it. Vision and sight, night impaired vision, and it's what lets you see things, okay? Without it, it doesn't happen. The immune system. It stimulates the white blood cells' function and increases the activity of antibodies in your body, proteins that will attach to foreign bodies, bacteria, viruses, and attack them, okay? The other part, it helps the immune system fight off infections by assisting the killing of viruses and bacteria in other ways. And beta-carotene is an antioxidant and destroys free radicals, which are unstable substances in your body that we think are really has a major responsibility for damaging your cells in the body and your tissues and your organs, and makes you predisposed to other conditions. And free radicals are believed to be responsible for advanced aging and sickness tendencies. Cancer. Vitamin A and retinoids have been found to inhibit tumor development and may protect damage in the cell membrane as well as the DNA, which is our genetic code, thus preventing or slowing certain tumor growths or developments. People whose diets are higher in vitamin A and beta-carotene and other carotenoids from foods decrease their risk of cancer in certain forms, such as breast, colon, esophageal, and cervical cancer. So the point of it is, if your family has this issue, this might be something that you really push forward to in a very aggressive manner. Epithelial cells, basically skin cells, the lining of your stomach lining, of your lungs, epithelial cells. A is needed by all epithelial cells. Okay, so anything that's basically a tube in your body, it helps. So it helps protect your skin. We know vitamin A in skin has been a big issue for years. People who develop skin cancer seem to have less amounts of beta-carotene and vitamin A in their bodies. So that should give us an indicator. It helps protect the skin, lungs, intestines, stomach, vaginal tract, urinary tract, bladder, and the eyes. Vitamin A helps to support and prevent bacteria from penetrating these linings and thus preventing many, many diseases. So if it doesn't penetrate the skin or these inner linings, guess what? You might not get sick at all. In pregnancy, A is essential for pregnant women because it helps with the postpartum tissue tears. In other words, you're going to repair faster, you're going to heal faster, because it makes the cell membrane tougher and stronger and more resilient, as well as maintaining normal vision, which helps fight off infections also, okay? All right, it can help fight off infections, I should say. Lack of vitamin A can cause night blindness in mothers. In other words, you can get an elevated tendency towards vitamin A deficiency, but again, this is when you watch real close, and there can be problems with the placenta and low birth weight in newborns. Vitamin A plays an essential role in embryonic development. That baby's development, it's very important because it plays a role in cell division. It's very important to the health of the neural tube, as well as the communication between cells and the development of the immune system during pregnancy. Again, part of our advanced information, we're going to look at skin. Vitamin A is the form of, you can get it in the form of retinol palmitate, okay? It's known to normalize skin tissue, and it penetrates the skin. Is also, if you can get a supplement that has some retinol palmitate in it, it's going to penetrate into your cell better, hold better, and be more functional. So we know that it helps the skin stay soft and plump. It actually plumps and thickens it, makes it moisture, and it increases significantly skin's composition. So as you're aging and your skin's thinning, it increases that collagen, helps the DNA, skin thickens, and the elasticity and flexibility of the skin actually stays better if you have enough vitamin A in your skin and in your body. Okay? Vitamin A is a big deal, isn't it? And it can make a huge difference in the long-term well-being of your skin if over a long period of time, vitamin A is there. Okay? Anti-infection. It's known as the anti-infection vitamin. It protects your body from infection. It protects invaders from penetrating the skin and the colon. Remember, that's a place that attack happens often. Food-sourced infections is frequent. And A is often seen in HIV infections, and vitamin A is actually lower in those people that have a tendency to have HIV infections, okay? And the ones that have higher, the HIV infections seem to be better maintained. Kind of interesting. And even moderate deficiencies may induce modifications in the left lung membranes they've documented in research, and it promotes to the greatest amount to decrease infections or just predisposition to them. So what's some of the possible benefits of vitamin A? Better vision, better night vision, helps in some vision disorders in general like cataracts, inhibits cancer growth and may reverse precancerous conditions in certain situations. Antioxidant properties may be helpful for Alzheimer's, chronic fatigue, male infertility, and fibromyalgia, and it is a powerful immune protector also. So protects also against formation of cataracts, we've already mentioned it, or at least postponing them, and it promotes wellness of the bones, eyes, hair, mucous membranes such as the sinuses, mouth, intestinal tract, esophagus, nails, skin, and teeth. You've heard about that also. So vitamin A, important, very important. Something that you need to be able to look through this video over and over and start thinking, well, do I take these medications? Have I had this tendency? Is my diet good enough? Have I watched Secrets of Vital Health so I know exactly what's good for me? And it's based upon my diet, whether vitamin A should be supplemented. Supplemented in a multiple vitamin first in my case, in my estimation, in all cases. And then anything beyond that should be taken under advisement and be added with hopefully wisdom, as well as some guidance from someone who's an expert in that area. And realize you have to deal with doctors that know nutrition. If they don't know much about nutrition, if it's not part of their specialty, asking somebody like me whether you should have brain surgery doesn't make a whole lot of sense, does it? You're probably not going to get the best information or the most accurate information. Deal with people who are dealing in this field that are well-versed, well-educated, and understand it fully. We hope that you've appreciated our coverage of vitamin A, and we hope you recommend it to friends and family, and it helps guide you in making good choices for you. We'll look for you next time. This is Dr. Benzinger on Health for secondopinion.org, and may God bless you.